All right, welcome back. Thanks very much for staying with us. We are now joined via Zoom by Dr. Prof Adrian Puren, the Executive Director at the National Institute for Communicable Diseases, to unpack the latest developments on the monkeypox in South Africa. Prof, a warm welcome to you, and thanks as always for agreeing to speak to us here on SABC News.
Thank you for the opportunity.
How concerning is the issue of monkeypox right now in South Africa? We heard the Health Minister, Dr. Paahla, saying that it is concerning, but on the back of that, he said, there's no worry at this point in terms of, getting vaccinations for monkeypox. Where are we at the moment, and what level of fear or concern should we be having?
So firstly, I think we should not fear. I think that's really critical. I think what we need to do is inform ourselves. Certainly, we've seen extensive numbers of cases in specific areas in the world, such as the United States, Europe, and the UK, as examples. However, in South Africa, when we look at our numbers, I think we have 5 cases now. And I think the initial risk assessment for South Africa, at least for the general population, is that it's low to mild. So I think from that perspective, I think that's really reassuring. I think what is critical, however, is that when you look at risk by what is happening in Europe and elsewhere, it's really trying to say or determine whether or not social or sexual networks in South Africa may be at higher risk, for example. So it's really critical that we ensure that the general public are aware of what is monkeypox and how it is transmitted from person to person, and likely approaches to management or treatment. That's really important. But also then to ensure that communities that may be at higher risk are also aware of these and are able to ensure that were they to present with particular signs and symptoms, that they have access to care and, wherever possible, some form of treatment at this time. I think we should not be fearful. I think that's really important that we don't go that route. I think we've gone through a very huge pandemic, COVID-19. This pandemic, with this particular outbreak, is really different. And so I think we just manage it appropriately. Yes.
And Doc, I think you anticipated my question then. I did want to talk about how different, in fact, this is to what we've already gone through. Yes. But also, what lessons should we have, in fact, learned? I think you touched on it quite briefly there from what we've experienced with COVID-19. You talk about the fact that, we're only on 5. But, I seem to remember that even with COVID-19, we were, starting with very small numbers, and then it overwhelmed us at the end of the day. So, I mean, what are some of the lessons we should have taken from that, so that we won't find ourselves in similar situation?
Absolutely. So certainly we've had 5 unlinked cases at this time, but you're right that we're unaware that there may well be circulating virus in our populations, and that we really need to create environments that will ensure that people are accessing, for example, diagnostics, where they're presenting with the signs and symptoms and the sort of lesions that are thought to be typical of monkeypox. So I think that's really critical. Yeah. So, for example, in South Africa, again, at least the diagnostics is certainly available both in the public and the private sector. That is available. I think also really critically important is also to have a good contact tracing process in order for us to really try and ensure that we are able to make contact with those individuals who have had what we call close contact with the cases, in order for us to try and again provide the necessary information, reassurance, and the ability to access care and treatment. This virus behaves very differently in terms of transmission. It's not as transmissible as, for example, COVID-19 is. Yeah. But as you've seen in Europe and elsewhere, the numbers have certainly increased. And I think that was the initial hesitation, I think, from WHO, was they thought, oh, well, maybe we'll reach a plateau and it will decline, but that didn't really happen. So you're quite right. I think we need to keep good track of the numbers in order to ensure that, again, it doesn't, for example, cross over from one network to the other, because, again, we're all susceptible to this particular infection. So it's really important that we be aware of how this infection transmits, and it's really through close contact. It's not an easy transmissible virus, but close skin contact, for example, is really an important way in which this virus spreads. Close face-to-face contact, through saliva, for example, is thought to be the key routes, and especially skin-to-skin contact, as the main primary routes for transmission for this particular virus.
Prof, I hear you talking about care and treatment of the virus. So far, I've been hearing about, that, people should be isolating. What exactly is the treatment? What goes into treating those found to have the disease? Or is it just a case of, you just let it heal, you isolate and just wait for it to sort of heal?
Sure. Yeah, so in the main, this disease is what we call a mild disease, although it's probably unpleasant for the individual experiencing this. So it's really what we call symptomatic treatment for pain and skin irritation, for example. But again, these lesions can be very painful, I believe, as well. So and I believe 1 or 2 people have actually ended up in hospital for pain treatment, for example. But in the main, it should be a mild disease. And what is really important is that a person with this particular disease is in isolation, ensures minimal contact with individuals in the same household in terms of sharing items, sharing spaces, including bedclothes, eating utensils and so forth. Those should be kept separate and in isolation. Again, I know that this can be very challenging. So it's really symptomatic relief and keeping in isolation, limited contact with individuals in the same household would be the best options. South Africa currently is not in position, I understand, to offer vaccine. And again, I don't know how challenging that will be, but certainly if this continues and the numbers increase, as you've seen in the UK and elsewhere, access to vaccines has become really an important way in which to control this. But again, access can be very limited. I think there are some antiretrovirals available, but again, access to these may not could be very, very challenging as well. So I think the options thus far, I think for South Africa, is really around identification of cases, make sure that the tracing and contact processes are in place, and provide whatever relief is needed, especially in those cases which may be more severe. So pregnant women and younger age groups and HIV and immunocompromised individuals are at more risk. So it's important to focus on those individuals and try and prevent spread reaching those particular individuals.
All right, very informative indeed. It's always a pleasure having you on the show. Thank you very much, Prof.
Pleasure. Thank you.
All right, that is the Executive Director at the National Institute for Communicable Diseases, Prof Adrian Puren, unpacking developments so far on monkeypox in South Africa, where of course 5 cases have now been reported.